So just confirm me whether we are live, and then what I will do today is I will start discussing some high yield topics for your NeetPG 2021 whenever I find time. And today I will be discussing about biochemistry. So once you tell me it is live, we will start our today's session, and the important topic for today is inborn errors of metabolism. So they are giving important questions, clinical based questions based upon this metabolism or errors of metabolism. So you should know what enzyme is deficient and what effect it causes. That means ki what clinical symptoms you will be getting and how you can investigate a newborn with this. You can see me now. I have just sent it. So I'm just sending the list to my broadcast group. So if you are not there in my group, you can send. I'll post a link of the group in the comment section. You can join that group and you will be getting the link whenever I do this. So just pardon me a minute. Okay, so I was receiving my dinner. So I think we are live and you can see me. Type yes if you can. I'll be knowing. Okay, so starting with the inborn errors of metabolism. So we will not go into very much detail for today. It will be a short session. Only thing that I will emphasize is how you can pick different diseases, what type of question they can ask from inborn errors of metabolism, because your recent AIMS and NBE have asked. So if we see this inborn errors of metabolism, these can be divided basically into 6 types. 6 types means either it will be due to amino acid disorders, carbohydrate metabolism disorders, lysosomal storage disorders, peroxisomal, or some endocrine and miscellaneous. So what is important for first is you should know ki which enzyme is deficient. So they are directly asking you ki which enzyme is deficient in tyrosinemia type 3. So you should be knowing that which enzyme is deficient in Fabry's disease, tyrosinemia and all other things, and then you need to differentiate between other diseases. So in the clinical question, what they will give is they will give you a history of unexplained death of a newborn, or they can give a history of a baby with poor feeding, persistent vomiting, seizures, tachypnea, changes in the skin, hepatomegaly, jaundice, hypotonia. So there will be some problem related to the newborn which might make you think about these inborn errors of metabolism. Then what you should see is what can all be the symptoms that will take you to the diagnosis. So some peculiar symptoms are there, signs are there which are fixed for a disease. Like if you see, this cataract can be seen in Zellweger's syndrome or in galactosemia. So type me which type of cataract you find in galactosemia. Heterochromia iris is again associated with Zellweger syndrome. So these are the tricks that you need to find from your question, and you need to think about these diseases. Then important is xanthomas. Xanthomas particularly will be seen in hyperlipidemias. Then perioral and perianal eruptions. So multiple carboxylase deficiency. Your patient, your baby will present with perioral perianal eruption. Increased pigmentation. In Fabry's disease, you will see angiokeratomas. So do make a note of these and I will post the PDF in that group so that you can later refer to. Now, regarding the different diseases and the enzymes that are deficient. So let us go to a summarized chart. So first we will see ki what enzyme is deficient in which disease, and then we will see ki how you can diagnose them. Okay, so we can start with glycogen storage diseases, and then mucopolysaccharides we can discuss. Okay, so let us discuss first the mucopolysaccharides only. So in mucopolysaccharides, these Hunter and Hurler disease. Hurler is type 1, Hunter is type 2. So in both of them, these both are important. Why? Because important is, one is regarding the enzyme deficiency. In Hurler you will find alpha L iduronidase deficiency. In Hunter you will find iduronate sulfatase deficiency. Another thing is, this Hunter disease is X-linked inheritance pattern. So that is why it is also important. Then other mucopolysaccharides, you should also remember that this San Filippo, Morque A and B, MPS4, that is marrow TX Lamy disease, MPS6 is marrow TX Lamy disease, MPX7 is Sly disease, and MPS9 is hyaluronidase deficiency. So they can directly ask you ki in MPS4 or in marrow TX Lamy disease what enzyme is deficient and what things you get. So basically in mucopolysaccharides what we get is symptoms like hepatosplenomegaly, skeletal deformity, and these things. There was one chart where the things are little more uh, given in a little more detailed way. So I was just finding that chart. Give me a sec. Yeah, so this one. You see in Hurlers in MPS1, the enzyme deficient is alpha L iduronidase. What you get is, you get mental retardation, congenital heart disease, corneal clouding, coarse facies, hydrocephalus, joint stiffness, hearing loss. So these many things are seen in Hurlers. Okay, in MPS2, that is Hunters, how you will differentiate Hurler from Hunters is, Hurler mental retardation will be present. In Hunter, for being a hunter you should be intelligent, so intelligence will be normal in case of Hunter's disease, and rest of the things, the vomiting and these coarse faces, these can be common, but intelligence will be normal in Hunters, while the baby will be mentally retarded in Hurlers. Hunter will be normal, Hurler will be mental retardation will be present. Then in MPS3, that is San Filippo, there is heparin N sulfatase deficiency. So you know this. What you will find is that baby will be hyperactive, mild somatic features, mental retardation, coarse hairs, hirsutism, and sleep disorders. So you need to know about each of them so that you can get the right diagnosis and say, means they will give you the clinical scenario and ask you which enzyme is. Okay. So another is molecule A and B. So here you will see a picture of odontoid hypoplasia, short trunk, IQ here will be normal, spleen will be normal. Marrow TX Lamy, that is MPS6, again IQ will be normal, but rest of the things will be similar to Hurler disease. And MPS7 is Sly, which is the enzyme deficient is beta glucuronidase. So let us revise the enzymes that were deficient. Hurler is alpha L iduronidase. Hunter is iduronate sulfatase. San Filippo is heparin N-sulfatase. Molecule A and B is galactose 6-sulfatase or beta-galactosidase. Marotx lame is N-acetyl galactosamine 4-sulfatase. So write it down in a paper and stick it in front of your study table. So you will keep on looking it and it won't means in finally you won't mistake in your final exam. So anything you find volatile, difficult, just write it down and stick in front of your table and leave the worry to that paper in which you have written, and just while you take breaks just go through the things you have written in front of your study table, because many times our mind feel bored by watching the mobile, the videos and the notes that we read. So for taking a break you can just play with your brain to watch over the sticken papers in front of your wall. And MPS 7 was SLY, that is beta glucuronidase is deficient. Okay, so this was about mucopolysaccharidosis. Let us see about glycogen storage diseases. So this is also pretty important, and in last we will discuss some more important point, how you can means what all questions they ask from it. So I'm just finding a small chart where everything is summarized so that you can in one chart only you can know what all things are there. So this is one where they have given the enzymes deficient, and yeah, so type 0 is the enzyme deficient is, these are basically glycogen storage disorder. So enzyme deficient is glycogen synthetase, you know it, I know. Type 1 is glucose 6-phosphate enzyme deficient. Type 2 is acid maltase, or what this type, these have a particular names, so you should also know their names. So type 1 was von Gierke, where the enzyme deficient is glucose 6-phosphatase. Okay, let me make it big so that you can see. Yeah, so type 1 is von Gierke, where the enzyme deficient is glucose 6-phosphatase. Type 2 is Pompe's disease. Enzyme deficient is lysosomal alpha glucosidase. 3 is Forbes amylo 1,6 glucosidase is deficient. 4 is Anderson and 5 is McArdle. In Anderson there is alpha means 1,4 alpha glucan branching enzyme deficiency, and in 5, that is McArdle, there is phosphorylase deficiency. So all the enzyme deficiency and the types you should know. Then the tissue affected, that means what all you will get. In von Gierke, patient will present with hepatomegaly, hypoglycemia, stunted growth, obesity, hypotonia. In 2, that is Pompe's, there will be heart failure and cardiomegaly. In type 3, that is FOBS, it will be just like type 1. Why I am so emphasizing on symptoms now? Because previously the pattern was just knowing the enzyme deficiency, so we didn't bothered about much about the clinical symptoms, but now they are framing clinical questions. So for that you should know how your patient will present in these glycogen storage disorders. Anderson disease is failure to thrive, hepatomegaly, cirrhosis and its complication. Okay, so why? Because there is abnormal glycogen structure. McArdle disease is only muscle is involved. That means muscle cramps, myoglobinuria after exercise, and liver is not involved. So in McArdle only liver is involved. In Anderson, McArdle only muscle is involved. Anderson liver is involved, that is due to abnormal glycogen structures and failure to thrive, hepatomegaly. In type 3 both liver and muscles will be involved. Okay, so type 3 both liver muscle, type 4 liver, and type 5 is muscle. Okay, so Anderson, liver, McArdle, muscle, Forbes, liver and muscle. In Pompey's, there was liver, muscle and heart. In von George, liver, intestine, kidney. So basically these are the basic things you should know. So in von George, what problem you will face is the patient will, if patient survive the initial hypoglycemia, that means due to this hypoglycemia and all, if he survives, the prognosis is good. In Pompey's, it is not very good. Forbes is again good. Anderson, death occurs usually in first 3 years, and 5, that is McArdle, where there is only muscle cramps and pain, the lifespan is usually normal, and we ask patients or babies not to do exercise because so exercise must be avoided due to the increased muscle pain and all. Okay, so I think it is clear for you for now these diseases and all. And if we look out to particular diseases, let us see about galactosemia. So in galactosemia, your galactose 1p uridyl transferase is deficient or galactokinase is deficient. What all you will get? Failure to thrive, hypoglycemia, and basically you can see galactose by the chromatography in the urine. So these all will be your, if a galactosemic infant is given milk, unmetabolized milk, sugar builds up and damages the liver, kidney, eyes, brain and all. In a similar way, fructosuria. Okay, so before that, one more easy and important chart is there, that is how you are going to identify the urine and the means by the smell of urine, how you are going to identify what disorders your patient is having. So let us see this chart where we are identifying the disease based upon the odor, based upon the smell of the urine. So in maple syrup urine disease, the abnormal odor will be like maple syrup. In isovaleric acidemia, it will be sweetie feet odor. So directly in question, you need to see this point ki what your examiner have mentioned. He would have mentioned 5-6 important points so as to differentiate and fetch your diagnosis. So you have to find this sweetie feet word from your question and answer it as isovaleric acidemia. In cystinuria or tyrosinemia type 1, it will be sulfur odor. In tyrosinemia type 1 also you get boiled cabbage odor. So very important, they have already asked this type 1, that is boiled cabbage odor. Okay, old fishy in trimethylaminiuria. And in MCD you will get like a cat's urine odor. In phenylketonuria, you all know it is mousy odor. Okay, so just to revise again, there was one more chart which we will see. So one more thing is Hawkins urea. In Hawkins urea, you will get swimming pool odor. Okay, isovaleric acidemia, you know it is sweetie feet odor. Maple syrup, you know. Boiled cabbage, you know. Tomka urinate, it is multiple carboxylase deficiency. Phenylketonuria, you know. Rotting fish, trimethylaminiuria. Tyrosinemia is again boiled cabbage odor. Okay, so this was about the different order of these things. Now, in a similar way, there was fructosuria, which was due to deficiency of inherited deficiency of these enzymes. So hereditary fructose 1,6-diphosphatase is deficient. Okay, so fructosuria usually occurs here in after eating fructose containing food because it is not able to metabolize. And how you are going to confirm it? By a liver biopsy. Okay, in some hemolytic diseases there will be pyruvate kinase deficiency and G6PD deficiency. You all know that it causes hemolytic disease. Among glycogen storage disease, we have already discussed it in brief. So you all know by now that type 1, just revise it with me, is caused by deficiency of glucose 6 phosphatase, and basically the symptoms and things, the clinical scenario you know. Type 2 is Pompe's disease, acid alpha glycosidase deficiency. Type 3 is deficiency of glycogen debranching enzyme. 4 is deficiency of branching enzyme, and type 5 is McArdle, which is deficiency of muscle phosphorylase. Type 6 is deficiency of liver phosphorylase or phosphorylase kinase. Okay, so 3 and 4 is very easy. 3 is deficiency of glycogen debranching enzyme, and 4 is deficiency of branching enzyme. Okay. And finally, how you are going to differentiate all of them. Phenylketonuria, you know, it is caused by deficiency of phenylalanine hydroxylase. And how you are going to screen by ferric chloride to detect urinary phenyl pyruvate by spectrometry. So this is just a picture of a child with phenylketonuria, and very important is tyrosinemia. So this tryptophan metabolism in tyrosinemia is very important for you. They had asked one time about the enzyme deficiency in type 2 tyrosinemia. So it is tyrosine aminotransferase. So all the cycles and chart you know, and you can just revise again. Any chart, any cycle you find difficult, you can draw it and stick in front of your study table. So leave some part of your study table, either the table, you can stick a chart paper, that white chart paper, over your study table, and write whatever important you find in while you study the whole day. So what you will have at the end of your study before revision is 5-6 chart paper with you, and then stick it all around your room. So whenever you roam around the room, just watch the important. So these really helps during last times of preparation, when you are 15 days before your examination and you are worried how to complete everything. So at that time, even if you are worried and roaming in the room, you are watching some important stuffs all around the room. Okay, so just what I did during my preparation is I took a white chart paper and stick it over the wooden study table, and whenever while reading, while watching, I found anything, I divided it into 4 sections, lines, and then start writing the important things by subject wise, whatever I am reading. Like anatomy, I have started writing the volatile points which I feel is volatile and I am easily forgetting. So in the anatomy section, so whenever again I read anatomy, I'll add at that section. So likewise it becomes little easy, because frequent revision is important to make things go into your permanent memory. Okay, so type 2 is tyrosine aminotransferase. So I want you to not mistake it if they ask you. Type 3 is 4-hydroxyphenyl pyruvate deoxygenase. Type 1 is due to fumarate acetoacetate. Now you must be thinking, I am not going into the cycle, the basic metabolism directly, I am telling what enzyme is deficient. Why I am doing so is, knowing the cycle is important, but our main aim is to answer in examination. That cycle you can keep on revising and you will be keep on forgetting. But what I want is you should know these important things even if you forget the cycle. So I don't expect you to remember everything in every cycle, but it is better if you revise and know the cycles. But there is no excuse for forgetting or mistaking these things if they ask you in the exam. So you cannot revise and learn all the 19 subjects 5-year thing and reciprocate or produce it in the short 6 months time of preparation. But you can know the important things and revise them frequently so that you don't forget them. You cannot afford to forget them. So type 1 is fumarate acetoacetate deficiency, type 2 is tyrosine aminotransferase, type 3 is 4-hydroxyphenyl pyruvate deoxygenase. So you can always go back and revise these cycles from your notes, because if I start teaching all the cycles, it would take me 2, 3, 4 hours to finish up. Maple syrup urine disease, branched chain keto acid dehydrogenase complex deficiency. Okay, So then is a more important thing is homocystinuria, where there is deficiency of cis-thione beta synthase. Okay, and urea cycle I'm not going into it because it's very common, but let us see 2-3 important thing is HHH syndrome. What is wrong here is mitochondrial ornithine transporter. HHH syndrome, mitochondrial ornithine transporter is deficient here. Okay, and other things you can just see orotic acid, OTC, CPS is glutamine and all. So uric acid is the important but very basic, so I'm not going much into it. And here this one we had already discussed, the lipid storage diseases. Let us just revise them once again. Okay, so Tay Sachs, we had discussed mucopolysaccharide. Lipid storage is still left. So Tay Sachs diseases, comment me what is the enzyme deficient. It is hexosaminidase. Fabry diseases, alpha galactosidase. Metachromatic leukodystrophy is aryl sulfatase A. Krabbe's diseases, beta galactosidase. Gaucher's diseases, beta glucosidase. Niemann-Pick is sphingomyelinase. So see the name Niemann-Pick, something with neurons and also sphingomyelinase. Far-based disease is ceramidase. So all this you should be having or learning it by heart. Tay-Sachs disease, hexosaminidase. Fabry's disease, alpha galactosidase. Metachromatic leukodystrophy is aryl sulfatase. Krabbe's disease is beta galactosidase. Gaucher's is beta glucosidase. Niemann-Pick very easy. Far-base is ceramidase, right? So again, easy but important to remember. And another important is Lish-Nyhan syndrome, which is due to hypoxanthine guanine phosphoribosyl transferase deficiency. So you can always make a note of all these inborn errors of metabolism in front of them, their enzyme deficiency, and read them again and again. Lish-Nyhan is hypoxanthine guanine phosphoribosyl transferase. What you need to do is you need to just identify this thing among the other 4 options or 3 options. Okay, and xanthine oxidase deficiency causes hypouricemia. So this is quite normal. Another thing is orotic aciduria, which is caused by orotate phosphoribosyl transferase. Now coming to the most important part of the session, that is how you are going to differentiate whether it is a ketone metabolism, whether it is amino acid disorder, or whether it is something else. So what you can do is clinical approach to hyperammonemia. If the patient is presenting with hyperammonemia, the first thing you need to see is whether your patient is having acidosis or not. If it is acidosis, obtain the organic acids that are causing it. So if they have mentioned it, then it will be due to that organic acidemia. If there is no acidosis, the next step you should see is whether there is elevation of any specific amino acid. If it is arginine, it will be arginemia. So they would have mentioned something in the question. So from there you can get the hint. It will be citrullinemia, it can be arginosuccinic acid, it can be HHH syndrome. Now if you didn't find any amino acid elevation in the question, you need to see the urine orotic acid. If it is high, it is OTC deficiency. If it is normal and low, then it can be anything like CPS synthase deficiency or others. So this was about hyperammonemia. When you will see the glycogen storage and the mucopolysaccharides, you can always go through the clinical symptoms that we discussed. You can always find the smell of urine and get an indication of the answer. That is swimming pool order. If they have mentioned, you get a hint of Hawkins urea. Maple syrup, you will get a hint of MSUD. Sweetie feed, you will get a hint of isovaleric acidemia. Mousy, phenylketonuria. Rotten fish, trimethylaminiuria, boiled cabbage, tyrosinemia. So these also will fetch you and hint to the diagnosis. So I think another thing is hyperammonemia we have discussed, but what about if it is normal? So if the plasma ammonia is normal, then again you see the blood pH. If it is acidosis, ammonia is normal, that means there is any fatty acid oxidation, means if there, and again if there is no ketosis, then there can be due to fatty acid oxidation defect, and if there is ketosis and lactic acidosis, then it will be something called organic aciduria or mitochondrial disorder. So I don't want to complicate, just know ki urea cycle defects will be very clear. They would have mentioned things about it, and you just need to see, because there are many enzymes, many step deficient. So every step have a different enzyme and different things to mention. So urea cycle defect is, you will find the ammonia normal, pH will ammonia you will find high, but pH will be normal. So again there will be no ketosis. If there is ketosis or lactic acidosis, it will fetch you towards the organic acidemia or mitochondrial acidemia. Okay, so the main aim is, you should, the basic minimum is, you should remember these names and their enzyme deficient. For glycogen storage diseases, you should know ki what is happening, the clinical symptoms, and same is for mucopolysaccharidosis, where like you should know ki how you are going to differentiate von Gierke from Pompey's and Anderson from McArdle. So in Anderson there will be hepatomegaly, failure to thrive, but in McArdle there will be only muscle pain. Enzyme deficiency you all know by now, and the similar way you should know how you are going to differentiate Hurler from Hunter's disease. Okay, so in Hurler there will be mental retardation, in Hunter there won't be any mental retardation. So like that, uh, you can just revise your part from inborn errors of metabolism, because they are really important. So might be I haven't covered everything in this session, but my taking off of this topic as high yield topic should give you a should give you a suspicion that you need to go through this topic again with regard to your microbiology, right? So MPS 1 Hurley's, MPS 2 Hunter, Sanfilippo, Marcus, Meritix, Lamy, and Sly disease. You should know what are the enzymes deficient. Hurler's alpha L iduronidase. Hunter is iduronate sulfatase. Morcu AB is galactose 6 sulfatase. Marotix Lamy is N-acetyl galactosamine 4 sulfatase, and Sly is beta gluconidase. So I think I should not prolong it too much. It will become overburdened. It will be like overburdening you. So for today, I'll end the session, and do let me know in comment what future topics you want. Otherwise, I'll be discussing some of the high yield topics, because your seniors have found key I'm good at predicting the important topics, because some of the questions have been directly from the videos which I teach on my channel as high yield topic. Okay, and I'll be posting the link of the Telegram group, and you can just give your numbers there. I will add you in the broadcast group also, and join that group. So I think I'm ending this. Stay happy, stay healthy, and take care.